Today on Cancer Buzz, the creation of a disease site-specific oncology patient navigation program to improve outcomes. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Our guest today joins us to discuss a community-based programs initiative to simply change the way, quote, it was always done. And now they provide patients with support, resources, and treatment. Stephanie Bonfilio is the Oncology Navigation Manager at St. Elizabeth Healthcare in Edgewood, Kentucky.
Our oncology leadership kind of recognized that our patients needed a little bit more care coordination and a more kind of all-around approach. And so it was really around 2019 that the leadership started to think about creating this oncology patient navigation program where a disease-specific nurse navigator would be tied to that patient based on their diagnosis and not tied to a specific provider's office. So not to the medical oncologist or the radiation oncologist, but really tied to that patient to help them get through the system efficiently and really be an advocate for that patient throughout that entire continuum of care.
How did you create a sustainable model?
One of our big things that I think is a huge value, patient experience is such a huge part of what we do in cancer care. And so we survey our patients. So the patients that are actively being navigated, we at different intervals survey them so that we're capturing new patients to see if the care that we're providing is of value to them. So is having this person on your care team, has that provided you value? And overwhelmingly, I believe it was like over 94% of our patients said that it increased their overall experience having a nurse navigator on their care team. So we really just kind of look at those different metrics that impact the entire program, the cancer program, certainly the hospital system, and determine how the navigators are impacting those specific things along the way.
What does the future of this program look like?
I think every patient deserves to have those, barriers assessed. So are there issues with your support system? Do you have, adequate insurance? Are there other financial concerns that you have aside from health insurance? So do you have food insecurity that we need to be aware of? Are there transportation barriers? That's a huge barrier for all kinds of people. So I think it's important that every patient has the opportunity to have a nurse navigator to be able to assess those barriers and then help get them to the right places to have those barriers removed so that they can get the best care possible, again, regardless of their disease type, their cancer type, their stage. So for St. Elizabeth, that's certainly kind of a goal where we see the program going. I think overall, really trying to delineate and hone in on some of those sort of back to that role delineation, really making sure that, the patients with the higher acuity, patients with the higher needs are getting the attention that they deserve.
What advice would you give to your colleagues who want to start something similar?
Yeah, I think that nurse navigation or patient navigation programs, it's still a very new thing in a lot of places. And it can be very overwhelming to just say, okay, we want to have a patient navigation program, let's start. And then where do you begin? And I always say, and I think it's really important, that you really just have to start small. So start somewhere and start small. We started with one disease site. So we navigated lung cancer patients in October of 2020, and we currently navigate 4 sites and have 5 nurse navigators and a couple more positions that are open. And so it's not been that long and the program has grown quickly. And I think part of that is because we sort of started slowly and really tried to lay a strong foundation to build on. And, we're not a big academic center. We're a small community cancer center. And I think the things that we've been able to do and the impact that nurses have been able to have on the oncology program as a whole, and most importantly, on individual patients' lives, has been huge.
Thank you, Stephanie. Stephanie authored a piece that details how St. Elizabeth Healthcare stood up their program and how it's growing. It's in the latest Oncology Issues journal, now in your inbox or online. There's a link in the show notes. Until next time, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.